Anybody else out there new to looking at hemodynamics and trying to put together the pieces of how heart rate, stroke volume, all that works together to give you a cardiac output? I've been there before. My name is Leah. I've been a CVSU nurse for 18 years, so let's chat about it. When we're talking about cardiac output in the ICU setting, we're going to be talking about this formula. Cardiac output is equal to heart rate times stroke volume. We need to break that down so that we can start to understand what cardiac output really means. So cardiac output is how much blood the heart can pump in a minute. And this is going to be the main contributing factor of what amount of perfusion and blood flow all the organs of your body get. So that's why it's so important. Especially if you work in a CVICU setting, then you're going to see that we really have to start to think through on our patients what things make up that cardiac output. So if we have the formula, heart rate times stroke volume, the heart rate piece is going to be pretty easy for us. We'll spend a whole nother video talking about it. But when we talk about the stroke volume, that might be a little more elusive or something that you haven't seen as much. So we'll spend a lot of time breaking that down. But the main contributing pieces of stroke volume are going to be preload, afterload, and contractility of the heart. We're going to use those things together to try to figure out how to best optimize the cardiac output. So depending on the setting that you're working in or the textbook you're looking at, you're probably going to see that we, instead of talking about cardiac output, most of the time we'll talk about cardiac index. I will tell you in the settings that I work in, a lot of times when somebody says, what's the cardiac output, they actually are meaning what is the cardiac index for that patient. So it's going to take, it's a math formula that takes basically the cardiac output and puts it down to the patient's like height, weight, and body mass so that it can be tailored for that patient. So for most books you'll look in, you'll see that the cardiac index needs to be above 2.5 for optimal perfusion. In the setting that I work in and have worked in for a long time, post-cardiac surgeries, open heart, all these different things, bypass surgery, we oftentimes can't get to 2.5. Like that patient's never getting to 2.5. We use above the cardiac index being above 2 to make sure that those vital organs are being perfused. And in our patient population, 2 is just kind of like the best that we can do a lot of times. Now, if I had a patient that came in and when I first hooked up their cardiac output monitor, I was able to see that their cardiac output was 3. I'm not waiting till it gets to 2 before I intervene. When it's starting to head down and we're hitting 2.5 and making phone calls, there's something going on. Let's try to figure something out. I'm looking at the hemodynamics to see if there's anything I can do as the bedside nurse. But overall, in a CVICU setting, post-cardiac surgery on sick patients, we're probably trying to hit that cardiac index above 2. So continue following this series. We're going to talk about heart rate and stroke volume and all the things that make that up, and follow along so that you can feel more confident and competent as a bedside nurse in a setting taking care of patients who have hemodynamic monitoring.